Thank you very much. Thank you. Thank you. Thank you. We are delighted to be here today. I want to thank all of you for hosting us and coming out in such wonderful numbers, and I want to especially thank the young people who are here. I want to begin by introducing the First Lady, my wife, Hillary. As many of you know, she is the chair of the President's Task Force on Health Care and came today to review the work of this wonderful clinic in anticipation of our presenting to the Congress a program to provide affordable health care for all Americans in the next several weeks. And we've had a wonderful time here today, and I want to introduce the person to my left who will speak in a moment, the Secretary of Health and Human Services, Donna Shalala. I also want to introduce two United States senators who came with us today. First, the chair of the Senate Committee on Labor and Human Resources, Senator Edward Kennedy of Massachusetts. And Senator Don Regal of Michigan. I'd like to thank Jim Hunter, the Arlington County Board Chair, for meeting us here. I know we have members of the Virginia Senate and House here, and the School Board Chair, Frank Wilson. I thank all of them for being here, but the two people I'd like to thank most today are the two fine public servants who showed us around, and I'd like to ask them to stand and be recognized. Dr. Susan Allen, the Arlington County Health Director. Where is Susan? And Sue Adams, the Family Health Bureau Chief. Thank you, Sue. We've had a wonderful time today. We got to walk through the process of what it was like for a parent to have a child immunized here. We saw the good news, which is that this place is doing a wonderful job of reaching people. We also saw some of the bad news, which is it's still pretty cumbersome to have a child immunized. And we did get to see a young woman of 20 months get her polio vaccine, which is an oral vaccine, so it was nice to see someone be vaccinated without pain. We came here today to make this day a landmark in the fight to protect the health of millions of our children. I can think of no better place to announce a new immunization policy than right here on the front lines of the fight to provide accessible, affordable health care to every family in this area. I'm pleased to be joined here by the children's advocates whom I have introduced. And I do want to say again our thanks to Sue Adams, the director of this clinic, and all the wonderful staff who came out and said hello to us and encouraged us along the way. This week I was startled to read of the case of a young boy named Rodney Miller, a 20-month-old child who lives in Miami, currently being treated for meningitis in the Jackson Memorial Hospital. He's there because he did not receive a meningitis vaccine that cost $21.48. The bill for his stay in the hospital has already topped $46,500. In the health care policy that our National Task Force is developing, nothing will be more important than preventive care. Today, American taxpayers are being hit with $10 in avoidable health care costs for every $1 we could be spending on immunizing our young people. The recent resurgence of measles in our country afflicted over 55,000 people, most of whom were children. The epidemic cost this country $20 million in avoidable hospital costs alone. Prevention would have cost $1 million. And those figures don't begin to take into account the terrible human cost the agony of a young man like Rodney Miller with his joints swollen, with his ankles so swollen they have to be relieved with needling to get the pus out, the pain and problems that he and many others will take throughout their lives simply because we don't immunize our children. And lest you think that this is a problem that every country has, I want you to know in this beautiful healthcare building that the United States has the third worst immunization record in this hemisphere. Of all the nations in this hemisphere, only Bolivia and Haiti have lower immunization rates for their children than the United States of America. Over the past 10 years, while immunization rates have been declining in many important areas, the price of vaccine has risen at 6 times the rate of inflation. Immunizing a child cost about $23 10 years ago. It costs more than $200 today. In a public clinic, the cost of fully immunizing a child has leapt from $7 to more than $90. Manufacturers of these vaccines cite the cost of research and development to defend the rising prices. Well, nobody wants research to slow down, but let's look at what's really happening. The pharmaceutical industry is spending $1 billion more each year on advertising and lobbying than it does on developing new and better drugs. Meanwhile, its profits are rising at 4 times the rate of the average Fortune 500 company. Compared to other countries, our prices are shocking. Listen to this. The polio vaccine in the United States currently costs close to $10. In England, the same drug is available for $1.80. In Belgium, it costs 77 cents. The problems of having an adequate delivery system, plus the spiraling costs, are putting America's children and America's future in jeopardy. To make matters worse, the makers of these vaccines have refused to make their products available to states at more affordable costs. I should tell you, those of you who don't know, that the federal government buys vaccines from the manufacturer and distributes it through the states and ultimately to people through the Center for Disease Control. We buy the vaccines at a much lower cost than a doctor can. The states often directly buy vaccines. They buy the vaccines at a higher cost than the federal government, but still at a lower cost than doctors. States can order large quantities and therefore should receive lower prices. But listen to this. While 10 states have succeeded in negotiating agreements with the vaccine manufacturers that allow them to immunize all the children they can reach, manufacturers are now balking at starting talks with other states. In fact, just recently, Texas, South Carolina, and Hawaii were all turned away. They were told that their efforts to get cheaper vaccines for their children were against public policy. Today, we must tell the drug companies to change those priorities. We cannot have profits at the expense of our children. These practices have got to stop. But I want to make it clear, dealing with the cost of vaccines will not be enough. We also have to improve the delivery of preventive care. I want to say to the members of the press and to all the people who are here, we should be under no illusion that every family and every child in America has access to a health clinic as good as this one. We should be under no illusion that every family and every child in America has access to a health clinic that opens at 7 in the morning and closes at 7 at night so that working families can bring their children. And even here, where there has been a dramatic increase in the number of children immunized, we are still seeing rates of about 70% immunization when the national goal and what is necessary to assure that there will be no outbreak of communicable diseases is 90%. Without an outreach program to go out and reach people where they are, in the languages they speak, in the homes, in the neighborhoods, and in the organizations that they frequent, we will not be able to reach this goal. So today I am announcing a 3-part policy to protect our children's future and to save the taxpayers millions of dollars. It will require changes on the part of all of us, and as I have in the last 3 weeks, I want to begin with the government so that we do our job first before we ask anyone else to change what they are doing. I'm pleased to announce that the job stimulus program that I will outline on Wednesday evening to the Congress will include $300 million to make vaccination services more widely available to all Americans. These funds will help public programs buy more vaccines. They will improve community services and personal outreach efforts. They will mean extended clinic hours all across America, more staff, and increased education efforts in conjunction with the Department of Education and the Department of Health and Human Services, and the resources necessary to create a national tracking system so we know what is happening to these children. These folks here are having a terrible time getting good and accurate records because we don't have a national tracking system. These are the kinds of things that the national government owes the American people and owes these fine public health professionals if we're going to do what we should be doing to help protect our children, and we will begin with that. Second, I am directing Secretary Shalala to begin negotiations with our drug manufacturers to assure that other states who do not have the arrangements that 10 do can buy the vaccines they need at affordable prices. There is no reason in the world why a child in Texas is unable to receive vaccinations while a child in Massachusetts can. We can't stand this kind of inequality simply because of the economic priorities of the manufacturers of the vaccine. It's wrong. Finally, the administration will prepare an initiative for my review in cooperation with key congressional health leaders such as Senator Kennedy, Senator Regal, Senator Bumper, Senator Pryor, Congressman Dingell, Waxman, and others, that will guarantee the immunization of every child in America. And I want to challenge the manufacturers of these vaccines to work with us. We cannot possibly justify financing research and development in future vaccines based on prices that will assure that children will not receive the vaccines that are available today. We can do better than that, and we have to. Our nation is the only industrialized nation in the entire world that does not guarantee childhood vaccination for all children. It ought to be like clean water and clean air. It ought to be a part of the fabric